Hi, my name is Dr. Neeraj Agarwal. I'm a professor of medicine in the Division of Oncology at the Huntsman Cancer Institute, University of Utah. I also direct the genitourinary oncology program at the Huntsman Cancer Institute. Today I'm going to talk about the Titan phase 3 trial, patient-reported outcomes data. So let me take a step back and discuss with you the Titan phase 3 trial results and what the trial was about. So Titan trial was a large phase 3 randomized clinical trial which recruited more than 1,000 patients and randomized them to standard androgen deprivation therapy versus androgen deprivation therapy plus the new androgen receptor blocker, a direct potent AR blocker, apalutamide, for metastatic castration-sensitive prostate cancer. The primary endpoints, or rather dual primary endpoints of the trial, were radiographic progression-free survival and overall survival. At the first interim analysis, after 22 months of the median follow-up, the trial reported positive for both primary endpoints. Both overall survival and radiographic progression-free survival were significantly improved on treatment with apalutamide plus androgen deprivation therapy versus standard androgen deprivation therapy. There was a 52% risk reduction, or rather 52% reduction in risk of radiographic progression and a 33% risk reduction in risk of death, or there was a 33% reduction in risk of death. So these data are amazing. And not surprisingly, these data led to approval of apalutamide by the FDA in September 2019. In ESMO 2019, we presented the health-related quality of life outcomes reported by the patients. So patient-reported outcomes on health-related quality of life, how patients were actually feeling, what kind of symptoms they're having, and how they were experiencing the overall treatment with apalutamide while they were experiencing survival benefit. One of the biggest concerns we have when we use these deeper androgen blockade strategies in our patients is the impact on quality of life and fatigue. In this study, patient-reported outcomes were collected throughout the treatment course using multiple validated tools such as FACT-P or European Quality of Life questionnaires, 5-level, 5-dimension questionnaires, and brief pain inventory, brief fatigue inventory, and so on. Patient had these questionnaires taken every cycle, and even after they had disease progression, they continued to report patient-reported outcomes or how they were feeling every 4 months. So an extensive quality of life data or patient-reported outcomes data were collected in this study. And what we showed in the ESMO 2019, that there was no deterioration in the health-related quality of life, even with using deeper androgen blockade with apalutamide. The health-related quality of life was preserved while patients were experiencing significant survival benefit. Most remarkably, there was no worsening of fatigue, which is considered until now synonymous with deeper androgen blockade. We did not show any worsening of fatigue in patients who were receiving treatment with apalutamide. So these are very encouraging results for my patients and a great news for the entire physician and doctors community. Thank you very much.